Infectious disease expert Dr. Zain Chagla is back with us ahead of the Thanksgiving weekend. Good to see you via Skype this morning.
Bob. Morning, Bob.
Good to see you. Yeah, first up, let's talk about this cabinet meeting that's happening at Queen's Park later this morning. We had a record 797 new cases yesterday. The medical officer of health says the alarm bells are ringing. How loud are those bells for you? And do you anticipate new restrictions, or should there be new restrictions?
Yeah, I mean, I think there's two things going on here. One, there's still a very regional context to everything that's happening, and most of the growth, again, we're seeing in Peel, Toronto, and Ottawa, although there are cases rising in Hamilton, as evidenced by the outbreaks that we heard of this week. I think we're starting to see cases rise. I think the number today, from what I understand, is going to be over 900, and given that it's a long weekend and everything going on, I think, unfortunately, what's happening in Toronto is ineffective contact tracing, long turnaround times, and high numbers. It's hard to sustain that situation while keeping everything open. So I presume there are going to be some changes coming soon.
Yeah, and boy, the number that you're expecting today, this really underscores how important it is to just, practice, a safe Thanksgiving weekend. I mean, this is problematic with, keeping it in the household with kids in university and wanting to come home.
Mm-hmm. Yeah.
What's your guidance?
I think you can do things safely still this weekend. I think you can still aim for the outdoors. We're supposed to have some good weather at least today and tomorrow. You can, do things virtually. You can do things with very small groups, like one or two, to support them, just to make sure they're not lonely this Thanksgiving. But, the big table dinner is obviously off the table, not only because of the transmission within that gathering, but everyone going back to their communities. We're seeing this as a regional outbreak, but we know a lot of people live in Toronto and Peel that are going to other places for Thanksgiving and then going back, and vice versa. So we have to be really careful. Otherwise, this could end up seeding a number of communities that have been actually faring relatively well.
Yeah, you mentioned outdoors. I believe you're having your Thanksgiving outdoors this weekend?
Mm-hmm. Mm-hmm. Yeah. Again, 2 meters apart, individual plates. But yeah, I think you could still do it safely out there.
Well, let's talk about Ottawa, one of the hot spots. And there was that barbecue with 40 people there. And there was just one documented transmission case, a couple of symptoms. But do you think the contact tracing was a little overblown?
I mean, I think, it demonstrates how one transmission can turn into many different events, but at the same time, I think you see that park party, that there was only one transmission event there. Again, this was a barbecue where they were not physically distanced. Obviously, backyard barbecue, you tend to have a lot more social and a lot more close contact. And so it just says the outdoors isn't zero risk. It's low risk, but you still have to do it properly in that sense.
Yeah. Donald Trump claims, and he's been back and forth on this, but he claimed recently that the flu is more deadly than COVID-19. And we've actually seen wild numbers on both sides. Can you break it down, the fact and fiction on mortality rates?
Yeah, the problem is so our assumptions of influenza are very different every year because we don't test for every influenza case, right? We haven't tested for every respiratory virus case really outside of the pandemic years. And so we always have this estimate of how many people actually have influenza in the community, but it can be really skewed. If you look at everyone who comes to hospital with influenza, obviously those are going to be the sicker people, but they're going to be the people that you're going to identify with influenza because they're sick and in hospital and need treatment. The difference with COVID-19 is we're trying to identify every single case, mild, moderate, or severe. And so the numbers are going to look like the fatality rate is lower, but again, it's not an apples to apples investigation. We're not identifying every mild influenza case in the community. We're using modeling to try to figure that out.
Before we run out of time, I want to ask you about Regeneron. Of course, Donald Trump said he was treated with that, and immediately the company is now asking for FDA approval. Is it safe? Is it reliable? What's your thoughts on it?
Yeah, I mean, they have some small data in phase 1, phase 2 trials. It is a mechanism of action that's worked with other diseases. The dangerous part of all of this is going straight for FDA approval means that we don't do those phase 3 trials, which are important to really show what its benefits are. We led to this problem with other drugs, and unfortunately, it sounds like this is going down that line. Hopefully, other countries can at least provide that supplemental data to say it's truly effective in large numbers. So we'll see. But again, this is another example of politics and science.
Yeah. All right, well, hey, good to see you again. Have a safe outdoor Thanksgiving weekend. Infectious disease specialist Dr. Zain Chagla. We got Brian standing by with the forecast for your weekend.